Hello, good afternoon or good morning, everyone. My name is Marlene. Hi, and this is the presentation on interpreter-friendly communication and patient education. Thank you for joining the presentation today. All right, and so health literacy is one of the skills of for medical interpreters. And as we know, medical interpreters facilitate the communication between the provider and the patients. And most especially for patients who do not speak English or have limited English proficiency, their health literacy can depend a lot on the interpreter's health literacy as well. So in this presentation, I will be sharing some tips on providing interpreter friendly patient information and when we're working with translators or interpreters. So this is the patient interpreter communication loop. So we have the patient and the provider, and the interpreter facilitates the communication between the patient and the provider. I just wanted to share a little bit about my perspective from my personal experience as a non-native English speaker from the Philippines. I'm from the Philippines and I speak the Filipino language that I learned in school. And I also have my own native language, which is an indigenous language from the Philippines. I've also been a nurse and RN in the US for, over 30 years since 1980. And I went back to school when I was 40 years old to get my master's degree in anthropology, concentrations in anthropology, communication, and international business. I started Culture Advantage in 2005, which was a cultural competency continuing education for nurses. And I started interpreter training online in 2009. And I have a short poll. And if anybody wants to share, it's actually just a yes or no question. Do you work with translators or interpreters in your job? Are you working with translators or interpreters? So that would be great if you can share your responses. Okay, and I will check with Scarlett if we have any responses, just a general idea of the responses. Uh, okay, Scarlett, are you able to? Uh, not okay. So let me see on the chat. Okay, so I don't see any responses at the moment, but that's all right. So we will continue. A lot of yes. Okay, so we see a lot of yeses. Thank you so much for sharing. And so we'll continue. There's another question. Okay, so if you work with interpreters, so the next question is. Going to go to the next question. Are you familiar with the difference between translating and interpreting? So it would just be a yes or no question. So if you have any responses, are you familiar with the difference between interpreting and translation? That would be great. Okay, so do we, if you are familiar with the difference between translation and interpreting, you can just respond yes or no, and that would be great. Thank you. Okay, I don't see the responses, but thank you for, if you have responded. Okay, so there is a group at your institution that is specifically utilized for research purposes. Thank you. Thank you for your responses. So I'm gonna go ahead. Yeah, some of you have not currently worked with translator or interpreters. Thank you for responding. Okay, so I'm going to the next slide, and I will talk about the difference between translator or interpreters. For some of us who are not familiar with translators and interpreters, translators work with written communication. So it would be translating written patient information into a written format, whereas interpreters work with verbal communication. So it will be like face-to-face or by phone or video interpreting. So that is the main difference. So when we're working with interpreters, we would refer to them as interpreters. And if they're doing the written translation, we would generally refer to them as translators. So that would be the main difference. There are certifying organizations for translators and interpreters, and they're different. For translators, we have the American Translator Association, and they actually have different standards for translation. For interpreting, we currently have two organizations providing a certification for medical interpreters. We have the CCHI, Certification Commission for Healthcare Interpreters, and the NBCMI, the National Board for Certification for Medical Interpreters. So those are two organizations that provide interpreting certification. And for American Sign Language, the Registry for Interpreters for the Deaf. This is just a summary of the main differences between translation and interpreting. So translators work with written text. It's mainly one-way communication. Their translators are supposed to be neutral and they're distant because of the written format. They're not on site. The one big difference is that they can format or reformat the message based on the audience. So you can ask them if you have a more complex patient information, you can ask them, I would like this to be translated in a 10th grade level or in a high school level. They can use resources, of course. They have time to do in-depth research, whereas interpreters are mainly, they are on site or on the phone. They work within the time pressure. They don't have time to do a lot of research. It's real-time performance. Interpreters may have dual roles as patient navigators, community health workers. They might be medical assistants. They may be nurses. They are impartial. Their role is impartial. However, they do have clarifier, cultural advocacy, and patient advocacy roles. And so this is a slide on the challenges or literacies, types of health literacies or types of literacies for spoken language interpreters. So they need to have language literacy, which is of course being bilingual. They need to have health literacy, knowledge of anatomy, diseases, treatments, procedures. They need to have cultural literacy. They have to navigate the cultural differences, and organizational literacy, which is knowledge of the healthcare services, knowledge of or being familiar with urgent care versus primary care versus emergency services. They need to know the admission process or different types of insurances. And for translators, basically the same. The main difference would be that they work with different types of audiences and they can rewrite the information based on which audience they should be writing for, whereas interpreters are not able to do that. All right. So if you're able to type on the chat, or you're able to share your main concerns when working with translators and interpreters, I will look at the chat if you're able to participate there. What are your main concerns when working with translators and interpreters? Either you have worked with them or you have not. If we can have just a couple of responses, that would be great. Yes, there's a response, not currently, but I have in the past when providing direct services. That's excellent. Thank you. Um, any specific any specific concerns that you can share? Okay. All right. And thank you for sharing that. I'm going to share some of the responses that I've had before, services. I did a survey when we started the medical interpreter program, and we had over 700. Okay, so one response, not knowing if they are actually getting my message across, and that is really excellent, maintaining the appropriate reading level. That's an excellent concern, and thank you for sharing that. And according to the survey that we have done, and it actually, your responses, intent and nuance. So that is really important, especially when we're working with cultural meanings of messages, and concerned the in-house translator, interpreter, and they may not have had training. Maintaining health literacy and reading level, that is a really strong concern when working with translators and interpreters. Yes, and so in the survey that we had over 785 responses, and these are some of their responses. Um, and especially when the patient is not able to see or hear. Another, and this is really important as well, how to convince my organization to have access to them, which means the translators and interpreters. Accuracy, yes. So about 50% of the responses that we've had previously was about accuracy. Concerned that message is lost in the interpretation, and that the information may not be completely or correctly shared with my patients. And that is, yes, that is a major concern. So accuracy, misinterpretation, interpreting the incorrect procedure or treatment, that is a valid concern for working with interpreters. And if you do not have enough interpreters in your organization, so again, access is certainly a very important concern. Competency and adequate training. Thank you. Yes, thank you for sharing. And that is one of the major concerns of the 785 responses that we've had. It was in 2009 actually, and it's still the same concerns that we have. Okay, so one of the concerns is that we don't have enough trained interpreters. And in this slide, it shows the main languages that are spoken at home. Yes, thank you. How to build rapport with the patient when you have an interpreter. That is certainly a major concern as well. So in this slide, we have the languages spoken at home. Most of these languages, these are the major languages. We have Spanish, Chinese, Tagalog, which is my native language, Vietnamese, Arabic. There's also French, Korean, Russian, Haitian, and German. Most of these major languages, we do have certification and training for interpreters, but a lot of the other languages, like Amharic and other Asian languages, Somali, for example, we don't have a lot of resources for these interpreters as well. And in the next slide, we can see the major languages again, they are represented in the certification for interpreters, but the languages that are called minority languages are not represented in certification for medical interpreting, especially for languages that are spoken by refugees. So a lot of our refugees, we do not have national certification for their languages. So that is a major concern when we are working with interpreters who might not have the same language proficiency as the major languages. I just want to review, what do medical translators and interpreters do? As I've mentioned previously, interpreters facilitate communication between the provider and the patient. So the source language of the provider, which is English, has to be converted into the target language. And accuracy, according to the standards for medical interpreting, means no omission, no addition, no editing, no summarizing, no change in meaning. And to be accurate, the interpreter has to convey linguistically equivalent information, a culturally understood information, and of course, a really big thing for us in the healthcare education field is clinically accurate information. In this slide, the interpreter has to navigate between the provider and the patient when they are interpreting. They have to manage the communication flow. They have to ask, what is the goal of the encounter? What is the meaning of this message that the provider is providing? What is the register? Register means the technical language of the speaker. The emotional tone, this would be more about the emotional experience of the patient. What are the critical words or critical information? So in interpreting, critical information means information that can put the patient's life or health at risk. So we can see that the interpreter has to manage all of these information, and it would be very challenging for this interpreter if they do not have the training, if they do not have the knowledge base, if they themselves do not have health literacy when they're interpreting for patients and providers. Language and culture are really intertwined and they affect communication. In this slide, L1 means language 1 into language 2, L2, and the culture of the patient and also the interpreter are taken into account when they're communicating with the provider. We can see in this next slide that these are the challenges and the literacies of the interpreter: cultural, health, linguistic, and organizational literacy. So if we have insufficient literacy in one area, it can affect patient safety, and there is greater risk for medical errors if they do not have health literacy or cultural or linguistic literacy. And I just want to share one of my experiences when I was working as a nurse, a new nurse in the United States. And I had a patient who asked me, "Nurse, I need to do number 1 and number 2." And as a new nurse, I tried to analyze this information I had not taken in my nursing program. I'm trying to remember, did I ever hear a number 1 or number 2? It wasn't in my nursing program that I learned. I actually went to school in the United States for my nursing, and I could not absolutely remember what was number 1 or number 2. And fortunately, my patient was very helpful, and she asked for the bedpan. "Hurry, I need the bedpan." And in that situation, I was able to learn what was number 1 and number 2. So this information was not something that was taught in my nursing program, but my patient helped me understand it. what is a six-pack. So this experience I just want to share because it was one of the doctors, a resident, actually one evening came to me and asked, Marlene, do you know what is a six-pack? And well, in my nursing background, mainly what I learned in school, I wasn't very acculturated, but I went to school in the US. And I thought about, well, I heard about beer belly. So my first thought was rectus abdominis. It's the anatomy. The physician actually was from Vietnam, and he was not a native English speaker. So in his mind, he was thinking about 7 Up, 6 Up, like a beverage that has this meaning of a six-pack. So between him and me, we were able to compare our cultural understanding of what is a six-pack and came up with what the patient actually meant when he was doing his medical history. And the patient said, well, I drink a six-pack every evening. And that message was lost in translation. But fortunately, we were able to analyze and come up with the correct interpretation of that message. So language can be challenging, especially if our interpreters are not acculturated in the American culture. Sometimes it's not the very technical term that could trip us up. So we have to be careful when we say trip, because sometimes that is culturally challenging word to interpret. Some of these examples that we have come across in our training program and also working as a nurse, scarring versus scarring. For example, we're talking to a patient about laparoscopic procedure, and the interpreter might not understand scarring versus scaring. Bland diet. This is a very common word that we use a lot. Might not think that it is culturally challenging. The word 24/7 that we throw out all the time, it might not make sense to somebody who is not familiar with the American culture. Again, twice a day, thrice a day, weekly, they can be misunderstood. Weekly can be misunderstood as gently. Skim milk, some cultures might not have skim milk, and it might be difficult for an interpreter who comes from a different culture to interpret skim milk if they do not have that in her culture. Fatal to fetal might be misunderstood. In this slide, I actually had an interpreter interpret pillows, elevate your leg on pillows to pills. Literally interpreted pillows, did not understand pillows or misheard pillows as pills. Dates, we have to be cognizant that sometimes dates are written in a different order in some languages, in some countries. Converting kilograms to pounds or pounds to kilograms might be challenging. And the same, similarly with temperatures like Celsius and Fahrenheit. Okay, and in this one example, this was a documented example of a translator. This was actually a translator error, but it ended up being a systems error instead of just a translator error. This was an error when translating a component for knee arthroplasty as cemented versus non-cemented. So for knee arthroplasty, sometimes they use cemented components, and sometimes they use a component without cement. And in the translation from English to German, it was mistranslated as cemented. Cemented was mistranslated as without cement. And the patients, there were a total of 47 patients with knee arthroplasties, and they did the incorrect procedure, and 30 patients needed revision. In this case, they did a root cause analysis, and they found that human factors played into the translation error. However, it started as a translation error, and then other system failures contributed to the event. Okay, so you might have some experiences that are not so serious, or it could be serious. Do you have any experiences to share? Maybe we have a few minutes for that. If you can put them in the chat. Various Burmese languages. Okay, yes. So that can be an excellent example. In different dialects, that's example, perfect there, because dialects can be misunderstood. And so when we're interpreting and working with interpreters, we need to remember that the interpreter is not actually the patient, and the information is filtered with the interpreter. So there is filtration of that information. So some tips for working with interpreters or translators, we can use the term and explain it. For example, we can say bland diet. So it means you do not put a lot of spices. It has to be soft. However you want to explain it, you can say the term and then provide more explanation. When comparing, so an example is scarring. Some patients or some interpreters might misunderstand that as scared instead of scars. Avoid using twice a day, 3 times a day. It's better to twice a day, thrice a day. It's better to say 2 times a day, 3 times a day, once a week instead of weekly. And then when explaining weights in pounds and kilograms, it is best to use 6 pounds, which is actually in kilograms. This is what is in kilograms, and do the conversions ourselves. And similarly with temperature and Fahrenheit and Celsius, to go ahead and do the conversions and then provide the conversion and the Fahrenheit and the Celsius if needed. And I just have some examples here of how can we re-explain these sentences. For blend diet, for example, our emergency room is open 24/7. We might want to re-explain that so it's easily understood. I have an example here of cataracts may cause ghost images. So we might want to rephrase ghost images so that they are easily understood by the interpreter. So those are just some examples that we can re-explain in a little bit more interpreter-friendly manner. As far as interpreting medical terminology, medications, and dosages, these are high frequency, high risk interpreting. So we need to be careful about medications and dosages. Abbreviations can be misunderstood. Complex diagnosis can be explained in a little bit more interpreter-friendly manner. And consent forms actually present a special case of interpreting. So I have some examples here. We always say this to the patient in this format. I'm going to prescribe warfarin, which is an anticoagulant daily, and you will be taking 5 milligrams a day. So it is best to have some a video or not video or images that we can show the patient. This is a very common dosage. It's peach colored or it's pink colored, the dosage. And what I mean is that you need to take 1 tablet. 1 tablet is 5 milligrams instead of the interpreter could misinterpret it as 5 tablets. And I actually had this experience when I was working in the hospital. The patient came in and she was taking 5 tablets of Coumadin, which is an anticoagulant, instead of 5 milligrams, instead of 1 tablet of 5 milligrams. Using pictures is important. Asking the interpreter to repeat back the medication and dosage, because this is a really critical information. And when they repeat it back to you, you make the corrections, tell the interpreter, this is the way I want the interpreter to, the patient to know, and make the corrections before they interpret it back, using a whiteboard to write the medication name and dosages so there is no misunderstanding. And teach back is really critical, not just for the patient, but for the interpreter. And I believe there is a really excellent there's a really excellent presentation coming up on Teachback, so I would recommend that. Okay, we have a comment here. When patients, okay, boo-boo, or yes, so sometimes when we talk to patients, or especially kids, oh, there's a little boo-boo, or, it's just it's gonna sting just a little bit. So again, that might be challenging for an interpreter. And so it's best to say the standard way, this could hurt a lot, this could hurt a little, so that the interpreter can interpret it more appropriately. When there is a question, can interpreters assist in overcoming cultural beliefs surrounding any mistrust of healthcare? When might this be appropriate? Any suggested training practices? Yes, so thank you for asking that. That is excellent. When we are working with interpreters, they actually have a conduit role. Conduit means to convey the information with no omission, no addition, no change in meaning. They have a patient advocacy role so that when the patient's life or health at risk, they can advocate for the patient. They have a cultural advocacy role so that they can culturally advocate for the patient. So as far as training interpreters for cultural beliefs, this will have to be outside of the interpreting encounter when you want to have the training practices so that you can work with the interpreters more directly. But however, during the actual encounter, when the nurse or the doctor is talking to the patient, one thing that we can do as providers is to ask the interpreter, based on the information provided to the patient, based on the patient information that we provided to the patient, can you see or are you able to identify any kind of cultural misunderstanding? And can you tell us about any possible cultural misunderstandings so that we can address those misunderstandings before the patient leaves? So that could be another way that we can work culturally with the patient before they leave the encounter. So this is another critical or very high risk situation where the interpreter is interpreting for pediatrics, for children, because the dosages for kids are based on weights and they're not standardized dosages. So having a picture, what is the difference between a teaspoon and a tablespoon? And for us, when we speak English, we might feel that, oh, it's very common, we don't need to explain it. But having a picture, even in your practice, having a teaspoon, an example like, oh, here's a teaspoon, here's a tablespoon, and being very clear about the differences between milliliters and ounces. For example, I had an interpreter interpret 5 milliliters as 5 ounces, and there's a huge difference between those dosages. So we want to make sure we actually have visuals when we're talking to parents about dosages for kids. All right, and this is just an exercise on consent forms. And I said consent forms are very, very different and requires really high degree of competence in health literacy in the patient. So I actually got these forms from different websites that have consent forms online. And so abbreviations are particularly challenging. So these are abbreviations for percutaneous nephrolithotomy, PCNL, well. So this would require a lot more explanation for the interpreter to interpret to the patient instead of just a plain percutaneous nephrolithotomy. ESWL, RIRS. So these are very challenging to interpret. I have an example here of an interpreter-friendly consent form from the Zuckerberg Francisco General Medical Center. And this is a link here. And this anesthesia form is really excellent. It's an example of interpreter-friendly, patient-friendly consent form. However, there was one area, one sentence where it says, with any medication given, you can have an allergic reaction. And it wasn't further defined. So if we talk about allergic reaction, some interpreters might have this idea, allergic reaction, oh, a rash. They might say allergic reaction like a rash, or they might be thinking if they have further training, they might think of anaphylactic reaction. So in this consent form, it actually was not defined what they meant by an allergic reaction. So we're putting some risk of interpreting error when we do not have those kind of explanations. Consent form, these are some tips for working with interpreters when they interpret consent form. Pre-session, so before the encounter, ask the interpreter, are you familiar with nephrolithotomy? If not, give them a brief summary of what this entails. Correct any misconceptions. Give them a copy of the form beforehand so they can scan and ask you, and encourage them to ask if they have any questions about the terminology. Some of our consent forms are very, very technical. During the session, this is with the patient, read verbally the consent form and ask the ask the interpreter if they have any questions, and then they can interpret one sentence, 1 to 2 sentences at a time. After each paragraph, check for the patient's understanding, and before signing the form, check the patient's understanding again. Post-session, after the session, check with the interpreter, ask them if there was anything that they feel they were not able to convey clearly or adequately. That way, they have another opportunity to correct if they feel maybe they have misinterpreted something in the consent form. They have an opportunity to make corrections or maybe ask questions again, and then we can follow up with the patient as needed. Medications are especially important to be very clear about any kind of information that we give patients about the medication. So I have here an example. If you do have an example or specific example about medication errors or concerns about medications, please feel free to type in the chat so we can see if we can analyze that situation. So I have an example here that it is a common instruction for patients. Okay, so this is a swish and swallow. We always say this is a nystatin oral suspension. You swish and swallow it. And the instructions actually say measure 6 milliliters of the swish and swallow, swish it in your mouth for several minutes, and then swallow. What we've found in our training program, even if we have a highly bilingual medical interpreter, they have difficulty interpreting swish and swallow or swishing it around your mouth. So for them, they have to look in the dictionary because they cannot convey this. They cannot convey the meaning of this term. So again, if you can demonstrate, use other words for swish, that will be excellent, or actually explain what this word means to you, how you want the patient to know. Vomiting versus puking. So this is an example here where you vomit and puke. Sometimes we feel that we want to use this common layman's term of puke instead of vomiting. So sometimes in these cases, it would be more appropriate to say vomiting, because this might be a word that the interpreter knows from their training, okay? Because they know vomiting versus puking. And I have to tell you, this is one of the terms that I had challenged understanding as a nurse, even though I felt I was acculturated as a nurse, and that is very, very important to consider. Are they HIPAA compliant, or are they made to sign a document for that? We have to be careful because a lot of interpreters may be working for themselves. So if they're working for themselves, somebody we just hired, they might not know about HIPAA. They might not have that HIPAA training behind them. But if we're working with interpreters who are with an interpreting or language services agency, they do need to sign a HIPAA form when they are hired by interpreter agencies. Would saying move the medicine around in your mouth? Yes, so that is a very excellent way of explaining what is swishing. Okay, so any way to say move the medicine, put the medicine in your mouth, do not swallow it, move it around. Okay, that is excellent. Excellent, yes. Uh, think of an option for immediate place to start when you're using to explain first. Find the most accessible language to explain in English first, and having that what is to be interpreted to the patient's preferred language. Okay, so that is one of the suggestions. More immediate place to start with the person or provider, considering the vocabulary they are using to explain first. Okay, so yes, so I think this is one of the challenge that we have, because sometimes we feel that I have to use layman's terms so that it is the patient can understand it, and we want them to be comfortable with us, and we don't want to use like the medical language. However, if the interpreter had this, some kind of training, they actually in their training they learn like vomit. So they learn that formal word, and so they might not have, if they're not acculturated themselves, and if English is not their primary language or their second, it's third language, they might not know what is puke or puking. So sometimes it is best to actually use the actual word in English instead of trying to use our own very common layman's term. Okay, so I think we have a few minutes left. Feel free to type your questions in the chat so we can address those questions. So I just have a couple of last slides here about the cultural aspects of interpreting. So I have an example here of the mini-mental status exam, which you're probably familiar with. This is when the provider is asking about checking for the patient's mental status, what is the day, what is the month, where are we, etc. And so here are some suggestions. And when they're using this, is actually a standardized form for the mental status, and it is written on that form. Give 3 objects. I'm going to name 3 objects: apple, table, penny. And after a couple of minutes, I'm going to ask you, what are these 3 objects? So this is to check for the patient's memory. So some suggestions are, and I have to share with you that penny, nickels, quarters, for me, when I came to the United States, they were very difficult for me to learn. Okay, so an example could be a more appropriate 3 words could be mango, banana, table, a car, or a train, instead of apple, because sometimes people don't actually think of apples if they do not come from a country that has apples. Okay, and pennies and coins, those are difficult because they might not have that in their cultural vocabulary yet. What is the role of field testing in translation? I found it's very useful to have extra eyes as proofreaders in target audience. Yes, so I would really recommend proofreading by the target audience, and working with them and see if they actually understood what the intent, the content, and the intent of the translation work. Thank you. Yes, that is excellent. Uh, how about conversations that require interpreters to be certified prior to using another language other than English with patients? This is a huge question from healthcare providers if they are native speakers, native language speakers. According to the Civil Rights Act of 1964, so that's actually what gives us the regulation in the law to provide language access, to provide translation, to provide interpreter services to our patients. According to the Civil Rights Act of 1964, and some of the regulations that came from that mandate, hiring bilingual providers, hiring bilingual staff is one of the ways to provide language access. Now, it is up to the organization to test the competency of their bilingual staff. So if you have a self-identified, I speak Russian or I speak Arabic, I come from Saudi Arabia, I come from an Arabic-speaking country, I speak Filipino, I come from the Philippines. It is up to the organization to have their own competency verification of this person who is a bilingual staff. And so, yes, we can. I don't find any law that says a bilingual provider cannot speak with the patients. I have found a joint commission, a link to a joint commission language from joint commission, that there are no standards for healthcare providers to speak with their patients in their native language. However, it is up to the organization to determine the language level of their bilingual staff. How can we know when a word we use, there's no equivalent in the translated language? So if a word does not have an equivalent translation, we can work with the interpreters. For example, skim milk, we can provide an explanation without asking the interpreter, or we can ask the interpreter, are you able to interpret skim milk? This milk is, we can provide the explanation. How do you communicate before pausing to allow interpreter to translate? I would recommend to pause after 1 to 2 sentences. If it's short sentences, after 2 sentences. If it's a long sentence and it is very technical, and it will be 1 sentence at a time. My institution currently provides translations upon request from clinicians. Recommendations for standardization of written materials prior to request. Yes, so that will be quite a lengthy recommendation for standardization. So I would recommend that you work with your patient education, that there's a patient education committee that will involve hands-on nursing staff who actually are working with the patient and then having their input. So that they can provide some input on making recommendations for standardized materials. Should interpreters and translators be certified? Yes, and I want to tell you that Oregon is the only state that requires a minimum of 60-hour training for interpreters instead of just a 40-hour training. And also they require the interpreters to have that training and to have certification for their certified medical interpreters. Definitely, because it gives us an assurance that interpreters and translators have a common knowledge, have a standardized knowledge base when they interpret, and that they have been tested on their skills. Can interpreters assist in overcoming cultural beliefs? And I believe that we were answered that in the, some previously. How do we deal with staff who wish to act as interpreter or translator? So that was the last question. You want to make sure that they are certified or trained or they have been tested. When interpreting, should short and clear sentences be used for better understanding in another language? Yes. So short and clear sentences. Do you provide the Poison Center as resource for those patients if they have questions about the medication? before referring patients for resources, I would recommend to go ahead and look at those sources and see if they are interpreter-friendly resources, if they're patient-friendly resources. And so should they be certified? What are your thoughts? So according to DSHS, which is the Health and Human Services, if you are working with translators and interpreters, they need to have the knowledge base of both languages. They have to have the health literacy in both languages. They should have been tested in their health literacy in both languages. And also they need to know and abide and demonstrate knowledge of interpreting and translator interpreting ethics and standards of practice. So if you have bilingual staff and if you feel that they have the knowledge base in both languages, you need to test them on their knowledge base in both languages, and not only the knowledge base of health literacy, but also are they able to adhere and can they demonstrate adherence to the standards of practice for medical interpreters and translators. So those are two competencies that you need to test them on before you allow them to be interpreters and translators in your organization. Any other questions? Feel free to put them in the chat. Okay. And if I missed any of those questions, feel free to rewrite them again on the chat so I can, if I had missed any of your questions, I would appreciate it if you would type them again if in case I had missed some of those previous questions. But I would like to really thank you for joining this presentation. I hope that it was helpful. You can also contact me if you have other questions. I believe there is a contact information somewhere at the IHA website. I would be glad to answer some other questions that you were not able to ask today. And so just to summarize, when we are speaking to the patients with a translator or with an interpreter, we are actually, our communication is filtered through the interpreter or the translator, so that we need to take into account the interpreters or translators' level of health literacy, level of linguistic competence, level of training, because otherwise our communication with the patient will be impaired, and some of the interpreting errors could lead to medical errors. So thank you for participating. If there are any other last messages or questions, I will be glad to answer them.